Now in this video, we'll talk about the need of motivational interviewing and why we would need it. Motivational interviewing is a helpful method, as we talked about, and is a way of speaking with individuals to help them to resolve their ambivalence. We use it to find motivation to change a behavior. It is practical and useful. It is a process to help individuals make more difficult decisions and motivate them toward positive change. Motivational interviewing was most commonly used with individuals that have addiction problems, as I mentioned before. And as you may know, those who work with individuals with addiction problems know there's a lot of ambivalence there. Should I change? Should I not change? Etc. Should I continue to drink? And what are the reasons that I should? Should I not drink? What are the reasons I should continue? But also, we see ambivalence in many other areas of life too. That is why motivational interviewing is effective in helping individuals with managing physical health concerns such as heart disease, diabetes, or asthma, which can be managed through behavioral changes. Motivational interviewing is also effective in career counseling because individuals are making tough life choices. Should I switch careers or majors, or should I stay where I'm at? These types of things are very important and big decisions. You can see that ambivalence or feeling stuck is a real experience for those that know that they want to make a change. Motivational interviewing can also be used to help prepare someone toward a more specific type of therapy, such as helping someone to realize that they need cognitive behavioral therapy in some situations, or whatever therapy or treatment plan they may need to get on to get started right away to alleviate symptoms or different mental or physical disorders or disabilities. Motivational interviewing is very effective for those who are unmotivated to change or feel they are unprepared for it. Now, this is where the power of motivational interviewing comes in. For example, someone with an addiction who has come in and doesn't think they have a problem, as many addicted individuals do experience this type of denial type of thing, this would be most suitable for motivational interviewing techniques. Or someone struggling with diabetes who doesn't think he or she needs to change their eating habits or doesn't care to. Or again, in career counseling, choosing a major or a career, being stuck on all the options, experiencing a great deal of ambivalence. This is where motivational interviewing can start. It encourages a client to engage through empathy. Counselors will talk with their clients and encourage them to talk about a perceived need to change or mention their reasons why change can be beneficial. Now, that's important. The counselor or interviewer listens and reflects what the client is speaking so that the client can again hear their reasons and motivations for change or not change. When the counselor expresses the client's thoughts back to him or her, this usually strengthens and motivates one toward change because you can reframe it in a different way that may spark motivation to change. This is done in a very careful way. Motivational interviewing evolved from the person-centered approach from Carl Rogers, and this approach was a method to help people to take charge and commit to difficult life decisions and make a change. Motivational interviewing really has two main goals. Goal 1 is to increase the client's motivation, and goal 2 is to help them commit to change. In motivational interviewing, we would have the client express the commitment to change. The reason being is that research has shown that a client's expressed commitment to change, and when they do commit to change and they come up with it on their own, they are more likely to follow through and make the changes necessary. So our role is just to elicit that desire and motivation. Many health professionals, counselors, and family members are concerned about their client or loved one not adhering to a treatment plan or a particular behavior or to improve their behavior. So getting others to follow through can be very difficult, obviously. So we need to know how to best help those individuals we work with to become motivated toward adherence, to adhere to a treatment plan. Up to 50% of individuals with a chronic medical or a mental health condition do not take their medications as directed, and many others do not do the daily management techniques to eliminate stress, anxiety, or the symptoms of diabetes, healthy diet, or any other worthwhile goal. The truth is that most people are only semi-adherent. We get advice, we may be provided with all the tools on something we're trying to at least help ourselves, but it is really up to us to follow through. So why don't we? A few potential problems is the lack of knowledge. People can be genuinely unsure about what steps to take, and they also need to know why it is important for them. It may have been accurately described and detailed to them and explained to them why it is important for them to follow through, but the information can be misunderstood as well. So there are cases where clients do not ask for clarification because they don't realize they have misunderstood or even may be embarrassed to ask for clarification. Another reason is that they do not know how to make the changes, how to acquire the daily behaviors, exercises, take the medication, or whatever it is that they have been instructed to take or do, because they experience barriers such as not finding the time in their day, or there might be issues with finding solutions to those barriers. Others might experience anxiety, for example, with exposure therapy or things that they might find difficult to do. Sometimes they do not grasp the importance of it, of what they are supposed to do. This is why just providing information in a counseling session is not usually as effective as eliciting change through motivational strategies within the individual. Some, on the other hand, may not even want to adhere at all, such as those with drug or alcohol problems. They want to eat, drink, and be merry here and now, even if their life is at risk. We need to respect the right of each client and to make their own decisions, but we can also help them to make more of an informed decision and help the client to make it on his or her own, which research has shown that decisions that are made by a client show much greater success and better client outcomes. Change is tricky for most of us, and it is even trickier to help someone change who doesn't want to see a need to. Think of a time you wanted to change something about yourself. Deep down you wanted to, but things got in the way. You didn't follow through as you should, right? So knowing that change is difficult at times, we must not get in the way with anyone unless we have a strong collaboration with them. It must be built on trust. When you don't have strong trust in a working relationship, clients will tell you what they know you want to hear. Now, collaboration is important. Very important. Collaboration doesn't mean that both sides, you and the client, are the same. In fact, they are quite different. You have specialized knowledge that is very good use for your client. They have knowledge of what it is like to try to adhere to recommendations and interventions that are recommended to them. This is why collaboration is vitally important. It also allows you to work together and be able to solve problems together as a team. But how do we do this? We do this by allowing some information exchange. The reason giving information may be necessary in some situations and throughout the counseling session is that it can help those that have a low adherence stemming from not being sure on what to do or a misunderstanding of what steps they need to take next. But we also have a problem to give too much information to the client or those we are working with. But you can see how motivational interviewing is really a technique that one adopts, and when the client or person you are working with needs more information to help them, that is when you can switch to giving information. Knowing that some clients do not know what to do or misunderstand certain things about their medication or treatment protocols or how to actually do something, you can give that information. Just be careful not to provide too much information, as it might be too much and can work against your progress with your client. Now, in this video, we talked about how motivational interviewing is very helpful for those experiencing ambivalence, and how MI, or motivational interviewing, is really a practical approach to help someone to prepare to change, and the power of motivational interviewing, and how it is all about supporting one to change and helping them to change and to come to the conclusion on their own that they do need to change. Some people do not think they have a problem to begin with or are fearful of moving forward, but in the next video, we will talk about the stages of change someone goes through. This will help you to know what motivational interviewing tools to use once you know how people change and the different stages of change. All right, see you in the next video.